Dr. Lederman, to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES, for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
New York's new 710 WOR.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES. 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back, and we have Beatrice on the line. Good morning.
Good morning, Dr. Lederman.
How are you today?
Very questionable.
Okay, what's your question?
My question is that I've been diagnosed on Friday, 2 days ago, that I have a distal rectum that is normal, and it's a rectal prolapse.
Uh-huh.
This is the fourth time I'm going to the hospital because I have a hemorrhoid. And when I eliminate, it comes out tissue.
Okay, well, you just need to call us. I know what you're talking about. It's not cancer, so just give me a call at 212-CHOICES during the week, and we'll help you find a way to fix it up for you, okay?
So I had a demand. This is the fourth time I went Friday because...
Right, but thank God it's not cancer. So just give me a call at 212-CHOICES during the week, and we will fix you up, okay?
Okay, Doc.
Thank you. I'll call during the week. God bless you, and thank you.
Okay, thank you.
Bye now.
Okay, bye-bye.
We were speaking about prostate cancer. We had a man who came in with a Gleason 6 PSA 4.97, so he's low risk because his Gleason score is 6 or less, low risk because his PSA is less than 10. He chose to be treated, and the success rate with us is about 95% to be cancer-free. Low risk, there's low, intermediate, and high-risk groups of prostate cancer, and it's based upon the stage, the Gleason, and the PSA. And there is, as I said earlier, a randomized study, so it was just published. It was published this week about prostate cancer. So there was a European randomized study that looked at men over 9 and 11-year follow-up. Now there's the 13-year follow-up, as reported by Schroeder in Lancet, and showed that screening in men for prostate cancer age 55 to 69 results in a 21% reduction in prostate cancer mortality and absolute benefit. So for men who want to know, should you get screened or not, 21% reduction in death rate from prostate. Now you can argue, do you want to pay the bill? Do you want to have a prostate biopsy? Those are things you can argue about. Some men say, I don't want a biopsy, I don't want to participate. That's great. But at least you know now, and it's a big study from Norway involving 162,000 men. randomized, that you can have a 21% reduction in mortality. And as I told you earlier, this man who presented with metastatic prostate cancer perhaps had someone sat down with him and told him that if had he been screened, he'd reduce his death rate by 21%. He would have gotten that PSA, which is 900 in that man, and been found before the cancer travels. I want to talk about a man who has lymphoma. He has lymphoma of both the right and left neck. He has massive lymphoma. He actually started out with CLL, which is a kind of leukemia, with transformation. So it transformed from leukemia to lymphoma. He had massive disease in the neck. It looked like big fists in his neck. He had 5 treatments after the informed consent process. After the first treatment, the cancer shrank by about 80%. He just finished the 5th treatment this week. That was on the left neck. Before, the left neck was so massive, you almost didn't look at the right neck. Now, because the left neck is normal, he wants to have the other side treated with the 5 radiosurgery treatments, and we will do that for him. He's had the treatments with no side effects and no complications, with very quick, impressive reduction of the size of those nodes down to normal now. And I had a woman call from Long Island who I treated 14 years ago. I haven't heard from her in years. She called up this week. In the note, I have the note in front of me. She called on 812. Mrs. X is very thankful for what you did for her. Thank you. And I called her up, and she told me she's a lady. She must be about 80 now. We treated her 14 years ago for cancer of the jaw. She's been in remission all these years. She now has a breast lump, and she wants us to get involved. She liked our first work, and that's the ultimate compliment if someone comes back or recommends their friend, and we appreciate that. And with another family who came in from the Bronx, went to a big hospital. He was sick. He is sick. He's 74 years old. He came in with esophageal cancer and also myelodysplasia. He lost consciousness, was taken to the hospital. He had a very low blood count, and a biopsy of the esophagus showed adenocarcinoma. He was transferred to another big hospital. They confirmed the diagnosis. They gave him blood transfusion. He's lost about 30 pounds. He went from 170 down to 145 pounds. He has trouble swallowing, can only eat pureed food. They want to be treated for the esophageal cancer. He does not want the esophageal cancer to be ignored, and he felt that's what's happening elsewhere. Elsewhere, they only offered him blood transfusions. So we're trying to put together a program, stage him up. Like I say, it may be boring to hear that, but when you have cancer, cancer means it has the ability to travel anywhere in the body. And before you start treating, you want to make sure you know exactly where the cancer is with the best possible tests. It makes sense. So if you have a disease that spreads, you want to know, has it spread or not spread? If it's localized, less cancer is obviously better than more cancer. We can treat stage 4 cancer, and we often do, but obviously if we can find it before it spreads, it's better for the patient. And speaking of abdominal cancers, we had a man who flew in from Barcelona, Spain this week with an ampulla of Vater cancer. Now, you want to give me a call if you know what the ampulla of Vater is? I know there's a lot of doctors who listen to the show, so you're excluded. I know you know the answer. Well, this man's a 63-year-old man. He's a businessman in Barcelona, and he's been fatigued and jaundiced, which means his skin has turned yellow. He was worked up in Spain. He was found to have a carcinoma of the ampulla of Vater. So let's do a little bit of anatomy. The liver and the pancreas make juices for digestion. Those digestive juices have to get to the intestine where the food has been chewed up and started in digestion by the mouth, by the stomach. Well, then the juices squirt into the intestine, and that point where they squirt in is called the ampulla of Vater. So the good news is that often cancers of the ampulla of Vater are diagnosed early because they're at this critical junction, and so they're found early when the patient has pain or jaundice. Diagnosed early means better chance of being cured. So he flew into New York for fractionated stereotactic radiosurgery for our treatment, and that's what he's getting. We got 2 treatments down, 3 to go, and he'll be back home in Barcelona soon. We had a woman who came in from Virginia. She's a 54-year-old woman with metastatic lung cancer. She's been coming to us and coming to chemotherapy people for the last 4 years. We've treated multiple sites in her abdomen and chest. All the sites we've treated have been successfully controlled. Unfortunately, chemotherapy is not working for her. She has new sites in the chest and in the neck and in the brain. So it's stage 4 cancer. Now, every site we've treated over these 4 years has been successful. In fact, one surgeon didn't believe us, so he opened up her head where we treated a brain metastasis, and what did he find? Dead tissue. So she's doing great. She started treatment this week. She's going to go home to see her son, who's overseas studying, and then she'll be back to finish up fractionated stereotactic radiosurgery for her lung cancer, which is metastatic, and for the brain metastasis. She's done great before. As I said, one surgeon biopsied a site that we treated just to see what it was, and he found dead tissue. Now, here's an interesting article that was published in Cancer Research, and the headline, it's by Joe Cavella, is that NSAIDs are non-steroidal anti-inflammatories like Advil and ibuprofen and Motrin and Aleve. The headline is, NSAIDs may reduce risk of breast cancer recurrence in overweight and obese women. So it's a very interesting study. Found that overweight and obese women who regularly used aspirin or other non-steroidal anti-inflammatories had a 52% lower rate of recurrence of their breast cancer. Can you believe that? So another positive aspirin story. Many of us take 81 milligrams of aspirin a day. So for women, this was obese women and overweight women with breast cancer. Women who took aspirin and non-steroidals had a 52% lower rate of breast cancer recurrence. This was published in Cancer Research. Wow. Did you ever think an aspirin could change your life so much? We're going to hear from our sponsor. We'll be right back. We're taking your calls. And again, if you have questions or want the booklet DVD, please call us. If you have medical questions, you can call us anytime, day or night, at 212-CHOICES, which is 212-246-4237. My name's Dr. Lederman, and here's a word from the folks.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.